region. Again, we look to make sure that there's not a lot of swelling, and if there is a lot of swelling, you can definitely refuse to massage an area, of course. But with the foot area, you can kind of just going to go back and forth, kind of stretch out, and try not to, right in the arch area, try not to stretch too abruptly there, because that's a big area too that they can start cramping up for a pregnant woman. So just kind of go slow, nice little stretch. And you can even perform like reflexology treatment here, or just a regular Swedish massage. But after you're done massaging the foot, make sure you wipe off the oil if you have any oil, or if you're not, just use the lotion instead, or just use nothing at all then. Because you don't want them to get up and walk around with oily feet, and they can slip and fall, of course. With the toes, you kind of separate, you got to lift them up. Again, whenever you perform once, make sure you perform it a couple more times. It's kind of the law of the massage field. You can even go in between the toes. And it's a good idea to look in between the toes to make sure there's no cracking at all before you perform that kind of technique. And pregnant women might be a little bit more self-conscious of their toes or their feet, especially if in the past they've taken really good care of their feet, but in the end of the third trimester, they might get a little bit more pedicures because they can't reach that area as much sometimes. You can even perform a little bit of a shimmy. Make sure your head isn't too close to there so you don't get hit yourself. And you can even squeeze. And right around here for reflexology, that's the ovaries and uterus right around the ankles. It's okay to start stimulating that area once they're ready to give birth, once the doctor says it's okay, but otherwise it's okay to massage, but not to hold and stimulate those areas then, of course. And right at the heel area, you can even use your knuckles right at the heel too. Or again, just kind of like pray for pain in that area too. On the top of the foot for reflexology base, that's the long chest and breast area, so it might be a little bit more tender. So just be aware of that. And you can perform just regular petrissage, kind of kneading techniques. If a pregnant woman has a job where they have to be on their feet all day long, this is probably the best area to massage for them. And to finish it off, you can kind of light techniques. Try not to glide with your fingers on the bottom of the foot, especially if they're ticklish. On the top, that's probably okay. And again, when you're done, just cover them up and even massage them a little bit in that area. In pregnant women, there's another problem they can have here. It's called tarsal tunnel syndrome. It's where the posterior tibial nerve gets impinged. And it's just like carpal tunnel syndrome, but it's in the foot, and where they can get numbness and tingling in the toe region and the foot region because of that then. So again, just like carpal tunnel syndrome up in the wrist, but there's a tarsal tunnel syndrome that can develop too. Or they could have sciatic problems where right in the glute region or even the lower back where the sciatic nerve can be impinged, and they can get tingling down the leg too. So that's another thing to be aware of for a pregnant woman.